The eukaryote is motile and finds its way through the gut wall of the mosquito and forms an oocyst. An oocyst. Now, this oocyst, the parasites in here are going to eventually transform into sporozoites. And from the gut wall, they find their way to the salivary gland of the mosquito. So when this mosquito goes for another blood meal, the cycle continues. So you can see, in humans, you have asexual reproduction. In the mosquito, you have sexual reproduction. So humans are intermediate hosts, while the mosquito vector is the definitive host. However, because humans are the hosts that give rise to the gametocytes, humans are regarded as the reservoir of infection. Because if the mosquito does not pick up the gametocytes, nothing will happen. Is that clear? Very good. So apart from an infected mosquito parasite coming as a vector coming in to inoculate the parasite during a blood meal, there are other ways by which malaria parasites may be acquired. It could be through blood transfusion. It could be vertically transmitted from an infected pregnant woman to the unborn baby through the placenta, or in people who abuse intravenous drugs, the sharing of these syringes can transmit malaria. Now, what happens? We've already gone through the life cycle. You know that essentially the parasites invade the red blood cells and destroys them. So the hallmark of the infection is the destruction of red blood cells. But apart from the parasites destroying the red cells during the process of replication, another feature of an infected red cell is that they now become, they become sticky. They start exhibiting some parasite-associated antigens on their cell membranes that make them very sticky. So the spleen sees them as abnormal, and the spleen will start mopping them up. So apart from the parasites destroying the red blood cells, you also have the spleen mopping up a lot of cells, even non-infected cells are mopped up. So we refer to that as sequestration. So that compounds the degree of anemia. Now, apart from that, the parasite biology